Hi everyone, I'm Srividya. Welcome to my channel on cardiology. So, in the previous video, we were talking about the aortic valve and what are the four valves in the heart and where exactly is the aortic valve located. Like I said before, it's located between the left ventricle and the aorta. So, what is the major function like? It's basically responsible for ensuring the blood flows in the right direction from the left ventricle into the aorta. Thus, what it does, it prevents backflow of blood. So, when the heart contracts, the aortic valve opens to allow the oxygen-rich blood to flow into the rest of the body via the aorta. And when the heart relaxes, the valve closes to prevent blood from flowing backward into the left ventricle. So this is what basically happens during the functions. So let's now we know where the aortic valve is situated. It's like in the middle of the heart. It lies between the left ventricle and the aorta. So it has got like 3 leaflets or cusps basically made of collagen. So how do you describe a healthy heart? So if a healthy heart, these leaflets open wide to allow the blood to flow through very nicely and then close tightly to prevent any backflow. So when the left ventricle contracts, it pushes the blood out, completely forcing the aortic valve to open up and allowing the full flow of oxygenated rich blood to enter the aorta. That's the opening function of it. And while closing, the ventricle relaxes. When it relaxes, the aortic valve closes to prevent blood from flowing backflow into the heart, ensuring that the blood moves forward into the systemic circulation, that is the rest of the body. So aortic valve plays a very important role in maintaining a proper blood circulation and oxygen being delivered to the entire part of the human body. So when we talk about aortic stenosis or like narrowing or regurgitation, like a leaking, these are the common main problems that can lead to serious health issues and sometimes even to heart failure. So when you talk of aortic valve diseases, you basically talk about aortic stenosis. So we all know, like when we talk about aortic stenosis, it's basically we are talking about the valve becoming narrow, and what happens is thus restricting the blood flow. Then the other part of it is aortic regurgitation. So what is this? This is when the valve is not able to close properly, either because it's too thick, and then it's allowing blood to leak back into the left ventricle. So these things can be like if it is depends on the severity, surgeries are the best part to work on that. And then you have the bicuspid aortic valve. This is a congenital condition where the valve has 2 leaflets instead of 3, which can lead to problems later in life. So now we will be thinking about what is the major treatment for this kind of aortic valvular diseases. Like we were talking about aortic stenosis, aortic regurgitation, then we were talking about bicuspid aortic valve, which is a congenital condition where the valve has 2 leaflets instead of 3, and which can be really dangerous. So the best would be, like I said, unless you come up with a final diagnosis, you have the complete history, which varies from individual to individual. So we have aortic valve surgery, wherein we try to replace or repair a damaged wall, or you have minimally invasive procedures which works as an alternative to open heart surgery. You don't have to really leave many scars. It's like a laparoscopic minimally invasive procedures. Then also there are other things like medications that can help manage symptoms and bring in more efficiency onto the heart function. So, but again, it depends on the underlying problems. It's not like a one singular problem. We are talking about the aortic wall. And many times what happens is when people start taking heart medicines after say couple of months, or after say sometime they say, okay, now you know what, maybe I'm not taken in the morning, I'll take it in the evening. Not an issue. You can take one time, you skip the next time you can take it. Like if it is not morning, you can take it in the evening, but it is not a good idea to skip your heart medications, and it's not something that you neglect. Heart medications cannot work on negligence. It can lead to severe health consequences, heart attack, stroke, or even death. So negligence is a very dangerous part when it comes to any medication. You can see when doctors are coming up with prescriptions and dispensing medications, and then the patients end up in administrating the medications. But if it is not administered properly, then it will result in failures to proper medication, and then it will lead to many risky factors. And heart attack is like sometimes it asymptomatic. People may not even know that. The best thing to avoid such things is such kind of situation is to take the medications regularly. Don't expect anybody to come and give you the medication. You should have these heart medications. It would be a good practice for all the patients to keep the heart medications handy, whether you are traveling by flight or train, or by say even bicycle, or you are traveling anywhere. It's a good practice to keep the heart medications handy. Nowadays you get your blood pressure. You can check up your blood pressure and take up your ECG, thanks to the Apple phones, where everything is readily available. Have something like a smart gadget available all the time if you're a heart patient, so that you will know what is going on, and keep the medications ready. Don't say I have it at home. Or sometimes heart attacks are such severe that you don't have even a second's time. Anything can happen. It can lead to a cardiac heart failure. So negligence is a big thing on the patient's part, and then if you don't understand the administration, you have to go to the medical practitioner and ask him to explain. Even it's nothing shameful or nothing bad if you don't understand. I think it's all the more good that even if you have given an information leaflet and you are not able to understand, you are not expected to understand all the medical abbreviations, even simple to non-simple. So you can go to your medical practitioner, or you can call them, WhatsApp. Now everybody and everything is available like in a jiffy of moment on your smartphones. So you can just write to them, say I don't understand how this medication has to be taken. And for me, patients, even I encourage patients, if you don't understand, do not be afraid to ask even n times, even 5 times, 6 times. Or if you want it to be even writing on the prescription, you don't have it all the time, I would suggest you have it digitally and readily available. So because of which you can worsen the heart conditions or if you take like a under treatment or over treatment, it can lead to heart failures or more complications in the heart. So it has got very dangerous side effects, whether even one dosage more or one dosage less can make one more hypotensive or hypotensive, or it can result in a heart failure. And side effects are really dangerous or really scary and dangerous. Of course, we medical practitioners help you in balancing, stabilizing you with ICU, CCU, but it's a long process, and it's good to be healthy always. So sometimes like delayed diagnosis can lead to delayed treatment, like then the potentially worsening the heart conditions. And even surgeons, I'm telling you, surgeons have to have a clear idea of what is going on, whether it is a valve replacement or bypass grafts, which can lead to heart damage and heart failure eventually. So many and improper medication management so can lead to additional problems. So you have to be very clear in the medications you are taking, because it can lead to a heart attack or stroke or even death. So if anyone has got a heart ailment, one good advice is keep your medication ready all the time, every time, and do not hesitate, do not feel shameful. You can ask n number of times your medical practitioner, WhatsApp them, ask them how the medication has to be taken. You have the right to know the mechanism of action. So you can be, patient education is most important. Not many hospitals do that, but I, as a doctor, medical practitioner, feel that every patient has to be educated onto what is taking. And please do not neglect your cardiac medicines, please. So I'm wishing you all, with the time constraint, I'm ending up this video and wishing you all a happy, healthy life. God bless. Thank you.